Hello and welcome to the Parkinson's Foundation Cognition Talk Series. Today's presentation is Thinking Changes in Parkinson's, Engaging the Social Worker. I'm Nancy Nealon, Community Program Manager for the New York, New Jersey chapter of the Parkinson's Foundation. Before we begin, I want to welcome those of you who are joining us for the first time and take just a moment to share the mission of the Parkinson's Foundation. We make life better for people living with Parkinson's by improving care and advancing research towards a cure. And we have everything you need to live better with Parkinson's. To achieve our mission, we pursue three goals: to improve care for everyone with Parkinson's, to advance research towards a cure, and to empower and educate our global community. And we do all of this building on the energy, experience, and passion of the global Parkinson's community. The PD Health at Home programs are presented by the Light of Day Foundation. Their generosity has made today's program possible. Thank you so much, Light of Day Foundation. Some people with Parkinson's disease experience mild cognitive impairment. The Parkinson's Foundation Cognition Talk Series focuses on cognition concerns and challenges. Parkinson's, as you know, is a very complex disease. Building a care team from a variety of disciplines who work collaboratively on your behalf should result in the delivery of the most optimal care for disease and symptom management. All of the pre-recorded talks in this series are presented by one of our care team professionals who will help you become more familiar with how each of them and their perspectives and recommendations can help you live your best life. Today's focus is to share the role of the social worker as part of your care team. With that, I would like to introduce our speaker for today, Ms. Elaine Book. Ms. Book has worked in the field of social work for over 30 years in a variety of community and hospital settings with an interest in the geriatric population. She is the center coordinator and clinic social worker for the Pacific Parkinson's Research Center, which is a Parkinson's Foundation Center of Excellence at the University of British Columbia in Vancouver, Canada. Elaine earned her bachelor's in social work from the University of Manitoba and her master's of social work from the University of British Columbia, with her thesis focusing on caregiver stress. She has continued to expand her training throughout her career, including cognitive behavioral therapy, advanced care planning, and social work instruction. With that, I'd like to introduce the video, and then once that's done, we'll come back live for your the Q&A session. Thank you.
Talk about cognitive change from a social work perspective. What are the roles that social workers play, or the issues that we address, and the ways in which a social worker may be helpful to you. And when I think about cognitive change and its impact on people with Parkinson's and the care partner, I think of these two quotes from people who I've worked with. The first quote is from the person with Parkinson's. And he looked at me one day and he said to me, "My place in the world is changing." And coincidentally, on another visit, when I was working with his care partner, she looked at me and she said, "This is not the same person I married." Cognitive change can impact many areas of life. It's more than just not remembering when to take meds or what the plan for the day was. And so I want to take a few minutes to talk about a few taboo topics that tend to be related to and impacted by cognitive change and have been the experience of many people who I have worked with, and it may be a part of your experience too. And so these three taboo topics are shame, embarrassment, and stigma, both for the person with Parkinson's and the care partner, difficult conversations that need to be had, and the third one is the impact of cognitive change on intimacy. Let's start off with stigma, embarrassment, and shame. Now, while there is agreement that Parkinson's disease does not cause shame or embarrassment, it is certainly recognized that in everyday interactions with others, there are some Parkinson's disease symptoms that might be negatively judged or misjudged by others. And cognitive changes is certainly one of those symptoms that can be negatively judged. As a way of dealing with this, people with Parkinson's start to shy away from social situations. They may start to avoid social situations. And it's interesting because many who have these feelings of shame or embarrassment tend not to discuss these feelings because it seems embarrassing or shameful to talk about one's shame and embarrassment. And so oftentimes these feelings don't get addressed, and they can lead to anxiety for the person with Parkinson's and may often go unnoticed by family or healthcare professionals. And we know that things that go unnoticed often go untreated. Now, similarly, for the person for the care partner, some of the behaviors that are associated with cognitive change can also be embarrassing for the care partner, and they may be reluctant to share with family members or healthcare professionals. And so some coping strategies for people with Parkinson's and their families in terms of dealing with shame and embarrassment with respect to cognitive change can include things like cognitive behavioral therapy. That's one strategy that can be helpful to kind of look very specifically at thought stopping strategies and certainly identifying irrational thinking, disrupting the negative self-talk that people often get trapped into. It's also helpful to look at your triggers of shame and work towards letting go of perfectionism. Another valuable strategy to deal with feelings of embarrassment or shame is to learn how to be self-compassionate. Simply put, be kind to yourself. So the second taboo topic was difficult conversations that need to be had. Now, with time, there are many conversations that are necessary to have as a result of cognitive change. For instance, when to stop driving, or financial management, or perhaps it's being able to manage meds on your own, or when to accept help coming into the house. But there also may be some conversations that need to be had because of cognitive change and the person with Parkinson's being unable to focus, to have difficulty making decisions, or following through on decisions that have been made. So I always find that when you head into difficult decisions, it's important to think about what are some of the emotions that might be attached to these difficult conversations. It might be loss, feelings of grief, anger, sadness. Any of those kinds of emotions certainly might be lingering beneath the conversation topic. And those are all very appropriate and very normal, but acknowledging these strong emotions can help get the conversation off to a good start. So again, think about being proactive when we're talking about having difficult conversations. Start having these conversations early on in the condition and put plans in place in case a problem should arise. Come to some understanding of what the rules might be in advance of the crisis. I worked with a woman who created what she called her psychological family. And these were a few very close and trusted people. And they had an agreement together that if they identified her doing something that was of concern, perhaps not exercising good judgment, they could come to her and tell her about it. And she knew that she could trust what they were saying had her best interests in mind. So you want to take these conversations slowly, one topic at a time, and you always want to think about the timing that you decide to have a difficult conversation. So perhaps not at the end of the day when everyone is tired, or perhaps not as you're rushing out to an appointment, but really taking into consideration timing when you're going to start a conversation. And I also recommend using notes. Notes might be helpful to kind of keep on track with what the most important points of the conversation are. And notes are also helpful to keep track of what was decided upon, so you can go back and look at that and remember what you had agreed to. Advanced care planning is another way to guide difficult topics about your health wishes and values. I'm going to talk a little bit more about that later, but it is good to keep in mind as a resource to guide challenging conversations. The last taboo topic that I was going to talk about is the impact of cognitive change on intimacy. Now, there are many sexual side effects to Parkinson's disease, including loss of desire, depression, fatigue, sleep issues, that masked face. But along with cognitive change are a few other experiences that people have, with the loss of change in self-esteem or communication, certainly role changes. And all of those things impact intimacy. And for the care partner, certainly caregiver stress, fatigue, and depression can impact desire and interest. So communication is really key, and you really want to try to look at ways to maintain and renew physical and emotional intimacy. You really want to try and talk about ways that you can remain close and reframe intimacy as more than sexual connections. You might want to talk about what you miss about each other or what you would like to have, and minimize conversations that point fingers at one another, lay blame, or talk about complaints within the relationship. Rather, it's focusing on what can you do in order to reconnect, to be close. Sometimes people decide to re-engage in a favorite activity that they used to do together, or even as simple as going to a restaurant that they both really enjoy. So it's about connecting with your heart first, and then the rest will follow. One tricky part of dealing with cognitive change is that sometimes it's really hard to figure out what is Parkinson's disease and cognitive change, what is normal aging, and what are some of the behaviors that are just part of the core personality of the person. And certainly the fluctuations that are common with Parkinson's disease make it extra tricky when we're talking about cognition, because we can find that a person with Parkinson's is clear and focused in the morning and not so clear and focused in the afternoon, or might have 3 or 4 days where is completely clear and focused, and then has another day where they're not. And so it's really hard to know from the care partner's perspective or from the family, what is fair to expect from the care partner or from the person with Parkinson's. So for the care partner, it's important to remember that the behavior changes in the person with Parkinson's is not about laziness or carelessness or an intentional lack of interest or just trying to make you crazy. But it's also important for the person with Parkinson's to recognize that you cannot use cognitive change as an excuse or a crutch for all kinds of behaviors that you could otherwise be working on. regardless of the cause of cognitive change or regardless of the challenging behaviors, coping strategies are needed. And so the overarching message in coping with Parkinson's disease is really to look at minimizing or mediating some of the day-to-day challenges in life. So a good starting place is to identify what the challenge is and then find solutions to work towards maintaining independence in daily life. So some practical, concrete suggestions might be, or suggestions to some common concerns that people bring forward to me. If the person with Parkinson's is feeling overwhelmed with too many responsibilities, then you might want to suggest that they delegate those responsibilities to other family members, friends, or even paid help. If the person with Parkinson's is having difficulty managing medications, well, it might be time to bring in some strategies to help remember. So that might be notes or pictures or signs or some smartphone applications like iMedication that can help to remember to take medications. Some people with Parkinson's and cognitive change have trouble keeping track of appointments. So again, it might be time to start using a paper calendar or other technological apps like Google Calendar. And that does bring me to technology, because technology now can be very helpful to address a number of challenges that are happening during the day. So for instance, there are a lot of ways to use technology to maintain social connections, because we know that social connections are so important in maintaining brain wellness. So things like Skype or FaceTime, in order to stay connected with family and friends near and far, is a wonderful use of technology. It can also be used for intellectual stimulation, because again, that's something we know is an important part of brain wellness. So things like Words with Friends or Luminosity or iScrabble are intellectual ways that you can remain stimulated by using technology. Technology is great for exercise programs. So if you're having trouble getting out of the house and getting to an exercise class, certainly there are many online exercise videos specifically for people with Parkinson's, and you can maintain your physical well-being at home as well. Lots of mindfulness apps available on through technology now online, things like 10% Happier, Breathe, Calm, Headspace. These are all different apps that people use in order to practice mindfulness. And technology can also be really helpful with promoting safety. So things like a GPS tracker on a smartphone can provide some reassurances to family members and to care partners if somebody is going out on their own. There's also emergency response systems like Lifeline that can also provide a sense of security for loved ones. Now, with cognitive change, communication can become challenging, but there are some simple ideas that can make a really big difference. So one of the things that I often suggest to people is to consider letting people in your immediate circle know of some of the cognitive challenges that you might be having. I think that tends to reduce anxiety for the person with Parkinson's and the care partner, and it allows people to more openly still remain socially engaged and having social connections. So by telling family and friends about the cognitive change, they can support you in the ways that you need to, rather than avoiding further social interactions. I would also recommend socializing in smaller groups and perhaps even focusing on one-to-one conversations. People often tell me about how difficult kind of big holiday dinners can be, where there's a lot of people around and a lot of background conversations. And so some of the suggestions that I often make are to have the person with Parkinson's who's got some cognitive change sitting at one end of the table and having a one-to-one conversation with the person who's sitting beside them. The other option is that you can also then rotate that person through that spot. So the person with Parkinson's is still getting to visit with everybody at the dinner, but in a way that works a little bit better. And certainly the options for going into another room to have that visit as well. So think about limiting distractions, background conversations, TV, radio, all of those kinds of things. Family need to remember to speak slowly, speak clearly, and use easy language. And to also stick with concrete ideas rather than abstract ideas, using either or questions rather than open-ended questions. So I would give, as an example, I would suggest saying, isn't it a nice day today, rather than what do you think of the weather today? Or would you like soup or sandwich for lunch today, rather than saying, what would you like for lunch today? So it's about limiting choices and to one or two options. So these are some really simple tips that you can employ yourself or share with family and friends. But the take-home message really here is focus on isolating what are the specific challenges and then address it by looking at a variety of different solutions. Look at the challenge and what are some of the options. And certainly tap into your healthcare team, because they are a great source of creative ideas as well. I'm going to switch gears a little bit and talk a little bit more about the emotional side effects of cognitive change, and talk about some of the strategies to deal with the emotions that are often associated with cognitive change. And in particular, I'm referring to loss and grief and anxiety. So I'm going to start with a definition about loss and grief so that you can better understand if this is an emotion that you are experiencing. So loss is the experience of parting with an object or an ability or a person or a change in a relationship that someone values. Losses can be minor or they can be major, and that designation really depends on the perception of the loss by the person experiencing the loss, the value that that person has placed on what was lost. Now, grief is the normal package of emotion: sadness, anger, fear, guilt, all of those emotions that accompany the loss of something valued. In the world of Parkinson's disease, there can be an experience of loss and grief for the person with Parkinson's from diagnosis throughout the entire progression of the disease as their abilities change. And now some of those losses are more obvious than others, certainly when you think about motor symptoms, especially for the person with Parkinson's. But less obvious losses include things like loss of past abilities, losses in present lifestyle, and certainly hopes for the future. There may be changes in sexual function, in career, in income. There might be losses and changes of freedoms, dignity, independence, certainty, and certainly changes in mental health and losses in cognitive function. Now, loss and grief can also be a part of the caregiving experience from diagnosis and throughout the progression of the condition as well. Feelings of loss for the care partners might involve changes in responsibilities, shared roles and responsibilities, changes in expectations for the future, certainly financial stability. There could be changes in their own social life and hobbies that they were able to engage in. There may be changes in their own career, as they may have had to stop working in order to take care of the person with Parkinson's. And so it's important to look at what are some of the ways to work through some of these feelings of loss and grief. So some strategies, one strategy includes journaling, really writing out your thoughts and feelings to effectively look at what is happening. Writing about your insights and your feelings and reflecting on them can be very empowering. And it can really provide you with a little bit of emotional distance from what's going on. It might make things a little bit more manageable and a little bit less frightening. So journaling is one strategy. Facing losses can leave you feeling a little bit out of control. And so to counter that, I often suggest to people that they really look at setting realistic goals with a plan that you can control and with a plan that can work and that will be meaningful and rewarding. I suggest to people that they surround themselves with people who feed them, who nourish them, people who will be there for you in good times and bad. And I also suggest sharing with your closest confidants as well, because sometimes when a loss is talked about, the hold that it has on you lessens. It becomes less impactful on you. And certainly there's always the option of seeking professional help as well. I also suggest to people when thinking about loss and grief to try and create something new based on what life looks like now. Find ways to seek out joy in your present experience. Work on letting go of what life looked like and focus on what it looks like today and embrace that. Focus on what you can do, what you have, and what is possible. I worked with a woman who had an I can picture. And so she had the words I can written in the middle. And then all around it, she had words written down of things that she can do. I can see my friends. I can listen to music. I can look at my garden. And so whenever she was having a low day, she would look at her I can picture. And she found that to be quite an empowering strategy. So now, closely related to feelings of loss and grief with cognitive change is certainly the feeling of anxiety. Anxiety is often a part of Parkinson's disease condition itself. And in relation to cognitive change, it can also be an emotional reaction about facing fear of more loss or more change. Parkinson's disease can have a very uncertain course, and anticipating what may or may not come can be quite unsettling. So addressing these feelings of anxiety is time well spent. In addition to medications that are available, you might consider the buffet of strategies that you can choose from. And some of those strategies might include engaging in regular exercise, maintaining a balanced diet, practicing good sleep hygiene. It might be looking at some counseling and some cognitive behavioral therapy. It could include taking up the practice of mindfulness. Lots of different kinds of strategies out there that can help both you, the person with Parkinson's, and you, the care partner. Another strategy that I like to recommend is to reach out to other healthcare professionals from different disciplines to look at ways in which they may be able to help you better manage some of the motor symptoms that might be causing you some anxiety. So, for example, a physiotherapist might help you with falls prevention that is now going to allow you to go out for dinner with more confidence. Or a speech language therapist might work with you on that quieter voice, and that's going to, again, give you more confidence to attend a family dinner and participate in social and remain socially engaged. And so the idea is that there may be some strategies to address some of the motor symptoms of Parkinson's that are leading to anxiety. And so if we address those motor symptoms, we might lead to an enhanced emotional well-being as well. Now I'd like to talk about advanced care planning as a strategy to cope with cognitive change, and one that many people who I have worked with have found it very valuable because it really does allow one to gain a sense of control about planning for the future. And it's about being proactive, and it's a process that's invaluable in giving people a voice and some control in their lives when oftentimes there feels like they don't have very much control in their lives. So advanced care planning, it is a process of reflection and communication. It is an opportunity to reflect on what your values are, what your wishes are, what your beliefs are around what kind of health and personal care you would want in the future if you were unable to speak for yourself. And so once you've reflected all of that, then it's important to share and communicate these beliefs that you have with the important people in your life, with your family, perhaps with a substitute decision maker, for the people who are going to speak for you if you cannot speak for yourself. So the process might include writing down some of your wishes and then talking with your family, with healthcare providers, perhaps with financial or legal professionals as well. Advanced care planning can really allow for concerns and potential needs and treatment options to be identified, to be discussed, and to be managed, really preempting a potential crisis. So it allows us to make our wishes known about future care, and it allows us to have control over the decision-making process. And this can be a very empowering and valuable experience for you, the person with Parkinson's, and also it can be very valuable for the care partner as well, because you will now have had conversations that are going to help guide difficult decisions that you may have to make, and certainly difficult decisions that may come up in a crisis or at an emotionally charged time. In closing, it's been said that Parkinson's disease is a family affair. And so when thinking about people with Parkinson's, I always think about the care partner as well. And I just want to say a few words about the value of the care partner and the important role that each one of you play in the physical, emotional, spiritual, and practical and cognitive well-being of the person with Parkinson's. The person with Parkinson's in your life is doing as well as they are doing because of the efforts and what you're doing for them. And as a result of that, they rely on your support. And so you really need to take care of yourself. It is so important for you to be able to take care of yourself and manage your well-being so that you can continue to do what you're doing for the person with Parkinson's. Just like on an airplane, when they instruct you to put an oxygen mask on top of your face first before helping someone else. Caregiving requires that same approach. The changes and the transitions that you and your family will face can be stressful. And it may require you all to shift in the way you would normally respond on a physical level, on an emotional level, on a practical level. And so you may need to try different strategies and different types of support at different times as you go along this journey of Parkinson's disease. There was a Greek philosopher who said, change is the only constant in life. And so remember to simplify and streamline your tasks and alter your expectations of yourself and of others.
Thank you so much, Elaine. Wow, I can't believe all that you packed into that about half-hour video. Thank you so much. And actually, I wanted to start by letting people know, because a number of people asked if this presentation will be available. And the answer to that is yes. All of you who have logged on, you registered for this program, you will receive an email. Give us a little time, a few days next week, and you'll receive a direct link to this video. So you can watch this over. And I'm thinking because you just have so much information, that will be such a helpful thing for people to be able to come back and check out all the various suggestions you made. But let's tackle some of these really important questions. I think this was asked in a couple of different ways. Elaine, what's your suggestion about how you deal with resistance or lack of awareness of cognitive changes on behalf of the person with Parkinson's?
So I think that's a really common question that I get oftentimes. And, I think it kind of goes back to a little bit of what I spoke to in the presentation about communication and how important communication between family members, between care partners and the person with Parkinson's is. And of course, you need to kind of look at your relationship and the nature of that relationship and old communication patterns, because that's what you've got to work with, right? It's kind of hard to start all over again when a diagnosis of Parkinson's comes along. So you kind of need to kind of take into consideration those those features of yourself and the patterns that have been engaged in. But I think one of the things that you really need to do is just be able to find the right time of day to have this conversation, and then really come to it with some examples. So, I have noticed X, Y, and Z. What do you think about that? And really just trying to open up the conversation in a non-confrontational, minimizing the emotions that are often attached with these difficult conversations, but having some kind of evidence is really an important thing to do. And of course, you always want to provide the support. It's like, I know this is hard for you, because imagine if somebody was coming to you and talking to you
Right.
about your cognition. So just acknowledging, I bet that this is really hard when you go to use your phone and you can't remember the number. That's got to be hard. And I'm here. So those kinds of things might be a way to start.
And actually, let me just segue to a question that actually asked, I thought a great question, that the person would really appreciate some opening lines to get this kind of conversation, communication going. So I think you just in effect took care of that, which it sounds to me like are some great suggestions. Since this particular segment is about engaging the social worker, let's talk about, how do you find a social worker?
Really good question as well. And I think in part that's because people have this kind of preconceived notion of a social worker, like you only need a social worker if you're having financial issues. And that's just not the case. And I hope that this morning's talk has enlightened people and helped people learn about the various different ways in which a social worker can be involved. But basically, one, if you've got Parkinson's, I would reach out to kind of your local movement disorders clinic, if you're associated with a movement disorders clinic. If not, a local Parkinson's organization or society. There's also the Parkinson's Foundation helpline, which has a wonderful repository of contacts of social workers. And then the other is that most provinces, most states, most countries have an association of social workers. So you can also Google your local association of social workers.
Great idea. Lots of good ones. And we'll also remind everyone about our helpline number. If nothing else, you can call our helpline. They are terrific. They will get you connected, get you as much information as possible. So we'll have that number for you as well. Other questions that people are asking about. For some people, in terms of dealing with individuals with Parkinson's, for those that might have the hallucinations or aren't quite sure who's in the house when in fact the spouse or the care partner is in the house. For care partners, how would you address that for them and trying to cope with that?
Mhm. And so, oftentimes I hear from people that, the physical symptoms, as challenging as they can be, it's the non-motor symptoms like uh, hallucinations or delusions or depression, anxiety. It's those non-motor um, and the cognitive change that is really so much more challenging to deal with. And so, with respect to hallucinations, well, first and foremost, I would absolutely approach your neurologist about that, because there are some medications that can be helpful in managing hallucinations. If the hallucinations are not frightening to the person, are not, that they've got some insight. Some people have insight into their hallucinations. So they'll say, you know what, that cat just walked across the floor again, but I know that we don't have a cat. And so it's not distressing or
Right.
that sort of thing. So some people have the insight, but for those who don't have the insight, for whom it's not frightening for, just acknowledging it, so, rather than saying, no, John, there was no cat there, because then you start getting into an argument because he really did see the cat. I think it's important to just say, right, that's your hallucination, and you just move on and you change the subject and you use distraction and that kind of thing. But by all means, I think it's something that should be mentioned to the family doctor or the neurologist.
Another, I think, important foundation for a question is because we have people watching and attending today who perhaps are recently diagnosed, individuals who have been living with Parkinson's for many years. We know it's a very slowly progressive neurological disease. When should you engage the professional help of a social worker, Elaine?
It's never too late or too early, I should say. It's never too early to engage in the social worker, because I think it's a little bit about you don't know what you don't know. So, you don't know what a social worker can offer until you connect with them. You don't know what an occupational therapist or a speech therapist might be able to do until you really connect with them. So, I think that's kind of my first message, is because you don't know what you don't know, anytime is the right time. But certainly, really, I think that they can also connect you with other resources. So while you may have a question about something that's not really social work, they are generally a wealth of connections and information and will be able to point you in the right direction to get the support that you need. So sooner than later.
Right, absolutely. And I should point out, once again, we've had our volume challenges during this webinar. And as you all know, working from various places these days, there happens to be construction going on outside of Elaine's home. That's the beeping that you're hearing. Of course, they're very active right now, but that's okay. It's just in the background, but I wanted to let you know what that noise was.
I apologize.
Things that we can never control. The fire alarm went off on me one day during a webinar as well. So Elaine, this is a question that I think we hear oftentimes is, how do you find a social worker or therapist who specializes in Parkinson's?
So again, I think I would go back to connecting to a movement disorders clinic, would be or a Parkinson's society, and again the helpline, because there's a program that is run through the Parkinson's Foundation, which is the Parkinson's Foundation Team Training Program, where they offer an intense course and train allied health professionals in. It's kind of a PD 101. So they have a list of all kind of alumni who have been trained through this program. So reaching out to them would be a good idea.
In as much as the Parkinson's Foundation strives to train as many professionals in the team approach for caring for people with Parkinson's and the entire system, there are definitely areas in the country, perhaps internationally, where we're not going to necessarily find a social worker who is particularly trained in Parkinson's. So when you think about social work competencies and areas, specific areas of or specialty of practice, how about maybe a couple? So if someone is looking and they can't find that Parkinson's specialist, but they find a social worker who specializes in, that might be a place to work with because the person can learn about Parkinson's, but how about some other specialties that might be a good fit?
So I think any social worker who works in a healthcare environment who would have some knowledge of, well, ideally neurological conditions would be helpful, but any kind of medical social worker might be able to assist as well. And then I think it's about even connecting to other counselors who might, who have a background in health, have a background in grief, in loss, in chronic conditions. So anybody who kind of falls into that umbrella might also be helpful.
Absolutely.
And I
Okay.
would also like to say that there is some overlay between nurse practitioners, nurses, physiotherapy or occupational therapists, so that you may be able to tap into the support of one of those disciplines who might be able to provide that counseling support, provide tips for like living life with Parkinson's. So if you can't access a social worker, you could try those other disciplines as well.
Excellent. Here's a question that I think is probably applicable in so many different situations, but a person asks, how do I help a person with Parkinson's from long distance? And in this case, the person references that he or she is 7 states away, which could be thousands of miles. How do you also help the primary caregiver in that case, who is perhaps elderly? So a tough situation from caring from afar.
For sure. So again, I think I'd go back to that connect with a team locally who might be able to kind of have boots on the ground and who are going to know so much more about the nuances of the community and the resources and the supports that are available. So first and foremost, I would connect with a local team or organization. The other thing is, with COVID, and one of the silver linings is technology, and so there's a lot of technology available out there that we can use in order to communicate better, to keep tabs, to get a better sense of what's going on in the home. So I would certainly consider that. And then the other thing is that there are small ways in which if you need to be more involved in, say, the paying of bills or organizing resources from afar, a lot of that stuff can be done online as well. So, you can set up automatic bill payments so that these bills are automatically coming out of an account or, a variety of other strategies where you can manage that from a distance.
Elaine, do you think it would be appropriate, and we've already touched on this a little bit, about perhaps a person with Parkinson's who isn't aware of their mild cognitive impairment or just can't think about it. Is it appropriate perhaps for the spouse, the partner, the caregiver to seek the services of a social worker, not necessarily for the person with Parkinson's, but for him or herself?
Absolutely. And I think kind of that speaks to you a little bit about how, the person with Parkinson's is the one with the diagnosis, but it impacts everybody in that family and it impacts that care partner. And sometimes I've worked with the person with Parkinson's who says, like, I don't want to tell anybody about this. I want this to just be between you and me. And I respect that. But on the same hand, we have to look at that care partner and say, you know what, that person is going through something too. Parkinson's is impacting them as well. And they need to seek out the support that they need. So that might be with a confidant or with a counselor or with a social worker or what have you. So it's really just important to recognize that we all have our own needs. We all respond to crises in our lives differently, and we need to try and be respectful of one another's needs. If that care partner doesn't have the opportunity to gain the support that they need, they're not going to be their best as a care partner.
Absolutely. So seeking support for yourself is absolutely a really healthy and good thing for you to do.
Absolutely. And you can provide assurances that you're going to keep it confidential or respectful or that sort of thing, but this is something that you need to do in order for you to be your best at a care partner role.
Absolutely. The next question is about adult children trying to assist a parent. And the adult children are asking, am I infringing on my father-in-law's autonomy or dignity by relaying our concerns to his doctor out of his presence or in a note through the electronic medical health record? Certainly something that perhaps the adult children are thinking, well, is dad really telling the doctor he can't find this or he's having difficulty driving? How do you suggest we address that?
Okay, so this comes up a lot. And I think what's really important is that we always have transparency. So as much as I might receive a call from that adult child and they tell me what their concerns are, it then becomes a very transparent process from there, where when we meet with the patient, it's open. We hope that the adult child will be there. We start the conversation from the beginning saying, listen, we're going to talk about some things that might be upsetting. We're going to talk about some things that you might disagree with, and everybody's going to have their opportunity to share at the same time. I think from a professional standpoint, we would not want to just take what the adult child has sent to us via email or a conversation and assume that that's the full picture. It's one piece of the puzzle. We completely respect and appreciate that collateral kind of information because it is true. People don't always disclose everything that's going on. And then if we don't know that a medication is adversely affecting them or that they're forgetting to take their medications, then we can't best help them. So that collateral information is really important to us, but we have to do it in a very respectful way.
Absolutely. Okay. The next question is rather lengthy, but I'm hoping you can summarize, because I think in different forms we have mentioned that cognitive behavioral therapy could be a real benefit for people. But someone is asking, can you actually describe what happens during, it's oftentimes referred to as CBT, cognitive behavioral therapy. Is that possible for you to do in a few moments, Elaine?
I'm going to give you the bare bones.
Okay.
Cognitive behavioral therapy is really, it's about how your thinking affects how you're feeling, and that then affects how you behave. And so it's this triangle, if you will, so thinking, feeling, and behaving. And so there are a lot of strategies that help how you think, change how you think about things, because that's going to change how you feel about things, and that's going to change how you behave. How's that for Cole's Notes version?
I think that's great. And once again, if someone is seeking out a therapist, social worker who specializes in CBT, that might be done in the same way as well, that you look for those people who advertise, you ask for their credentials, et cetera. Is that correct?
Yeah, absolutely. And I mean, there are some online programs as well. So you can certainly do some versions of this independently and online. But again, if you kind of Google your local counseling association, and they often have filters, so you can put in there somebody who's got experience with CBT, and then you'll get them that way.
Okay, great. And I think as we are winding down, this isn't exactly the last question, but I want to go in the direction of how do we pay for this service? How do we get help, et cetera? And we have to acknowledge, of course, that Elaine is a practitioner in Canada, but we are also practitioners here in the United States. So we want to try and address as many of these questions as possible. So Elaine, when it comes to a Parkinson's Foundation Center of Excellence, are the social work services, are your services included in care when somebody comes to your center?
In Canada, yes. So across Canada, anybody who's connected to a Parkinson's or movement disorders clinic, there are no extra charges for the social work services. And I think it's quite different in the United States. So I think, Nancy, I need to pass that back to you.
Well, and I can speak to, of course, the University of Rochester Center of Excellence, and there is a full-time social worker that she is included in as part of the team. And I think going and checking with if you have the ability to get to a Center of Excellence and finding out who is on their team, that's one way. Also, I would encourage people, this is for folks in the United States, and it varies, of course, from county to county to state, but most places have some kind of office for the aging. And I would encourage people that they should look that up, check it out. Once again, encourage you to call our helpline, 1-800-4PD-INFO, and we'll give you that information again right at the end. And our helpline specialists most definitely can help you navigate all of that. Elaine, in Canada, are there any nurses generally are the folks doing it here, but who basically are care coordinators, and they might help someone with the adult children who are trying to care from afar. They might help someone in their own town. So I'm curious because I wanted to mention that service, and it's a for-profit paid service, but that exists too. Does that exist in Canada?
Absolutely. And again, really varieties of it from province to province and city to city in terms of how that is available. But that is certainly an option as well.
So perhaps it won't be the answer for everyone, but that is yet another way, something else that you can pursue.
Exactly.
And in terms of insurance, this is, of course, a tricky topic to cover. I would suggest people check directly with whoever their third-party insurers are in terms of what's covered and what isn't. It does vary, and you have to check with that from place to place. So in trying to answer, can a social worker help me find paid help? Perhaps, but you really have to figure out what step is first there. And then, Elaine, this is going to be our last question for today. We haven't touched on support groups at all, and there are some inquiries about, are there support groups that help male caregivers, or are there support groups that help female caregivers? Can you address that?
So is the question, are there separate support groups for male caregivers and female caregivers? Not to be vague in my answer, excuse me, but I think, again, that really just depends on where you're living and what kinds of resources are available. Off the top of my head, I'm not aware of any male caregiver online support groups, which would kind of be ideal because then people could tap in from all over the place. So there's a goal for somebody out there who may have written in that question.
Yes.
I suspect that there would be some real uptake on that and some real traction for that. Having said that, though, I know a number of male caregivers who attend a care partner support group, and they have never ever commented to me that they felt that their needs were not addressed by attending a male and female care partner group. And I think that they contribute greatly to the conversation and to the support.
And it could be that if there is not a specific care partners support group for people with Parkinson's, perhaps there might be a care partner support group in general that, the common denominator there is that everyone is a care partner, although it could be cancer, Alzheimer's, et cetera. That would be something that could be a support system as well.
Absolutely. You know what? There is not one recipe. There's not one fit for everywhere, all different. We all need to get our support in different ways. I think what the most important thing is that if you are needing support, look at all of the different options for getting it, whether it's in person, whether it's online, whether it's in a group format, whether it's from a team, whatever that looks like. Just don't hesitate in reflecting on what are your needs and how can you get those met.
And how much of a strength that is to address the fact that you are getting that support. So, Elaine, thank you so very much for your wonderful recording, all of that information, for answering all of our questions today. And I know we didn't get to all of them, so I apologize. There really were quite a few from pre-registration and during the webinar today. But thank you so much, Elaine. And thank you to all of you who participated today. and who tuned in. We are so happy that you joined us today. And a reminder, you will receive a follow-up email, and you will have a direct link to our presentation. So you can watch this over, you can watch snippets, however you need to get that information. And I also want to make sure that you know that there's lots more you can tap into through our PD Health at Home program. So in addition to what we did today and what we've been doing for a couple weeks on Wednesdays, we host virtual events every Monday, Wednesday, and Friday. And to learn more and register, please visit us at parkinson.org/pdhealth. And you can join us for all kinds of programs. Next week in particular, we have Creative Connections. Did you know that art therapy can help you improve physical, psychological, and social functioning for people living with Parkinson's? You should really check that out. It's going to be a really unique program. So I encourage you, parkinson.org/pdhealth. And lastly, we're here for you. So contact us, parkinson.org, call the helpline. We can answer your questions, get you connected. And once again, thank you very much for joining us. And I wish you all staying safe and healthy.